Dharmendra ji, Dr. Sareen, Madam Changsan, Vipin Kumar ji, Dr. R.N. Singh, Honorable Boni Kapoor ji, film producer, celebrity, very badly required to communicate the message which Dr. Sareen is made a vociferous message should be reached to the people of India, and I think we can reach that message only through the films, and I think we are very happy to have him here to convey that message. And my dear students and ladies and gentlemen, first of all I would like to congratulate Dr. Sareen ji for organizing this continuously 27th year the Hepatitis Day and focusing on public awareness. This is a public health problem, and in this public health, I think, being though he is a head of the institution of the tertiary institution, focusing on the prevention. That is, I think, many a times the people sit in the tertiary institution only taking care of the clinical things. But whereas he is focusing on the prevention, that is a more important aspect of this hepatitis day. I think Dr. Sareenji mentioned how important, how this it is estimated about 40 million people infected with hepatitis B, and about 12 million people is infected with the hepatitis C. Hepatitis B and C are a major contributor to liver cancer. The National Viral Hepatitis Control Program launched by the Government of India in 2018 to control and eliminate viral hepatitis in India. And also it is keeping in mind the India is a signatory for the Sustainable Development Goal, and SDG 3.3 is focusing on the liver. So therefore this the national program is rightly achieve this target of the SDG goals. And some of the strategies which are involved in this, which very rightly already it has come out in a different format: screening and testing. Vaccination is very important, which Dr. Sareen focused about it. The provision of antiviral treatment for B and C, and the promotion of safe injection practices and blood transfusion. We as the nursing fraternity, we are largely involved in the practicing the safe injection practices. We are the custodian of the patient safety in the hospital. So therefore, this is a very important for the nursing and midwifery professional for promotion of the safe injection practice, and a lot of things involved, and also involved with the blood transfusion. The awareness campaign, which is very important, which is, I think, I could see how the students from the nursing schools and colleges and also the other public institutions are involved, and that is the message, and I could see the interest has been created by the way the posters have been prepared by the students. I think that's at least each one will get a message to each family and to the friends and to the colleagues. I think that's how we should take this forward. And one of the target which the Sustainable Development Goals, which has been expressed, reduce the prevalence of the hepatitis B and C by 30% by 2025. You all know that how Sustainable Development Goal, how the universal health coverage, which the United Nations, where the India is a signatory for the achieving the Sustainable Development Goal, and we, the nursing and midwifery professionals, constitute the largest human resource in the healthcare delivery system. Especially about 150,000 the Arogya Mandirs which are there, where these manned by our nursing professionals, especially the latest Government of India initiative is community health officer. The majority of the community health officers happen to be the BSc graduates. So they are taking a very important role at the sub-center level, and especially the prevention and the vaccination, which is one of the core component of this national program, where the nurses and midwives are involved. So in achieving this Sustainable Development Goal, and especially the WHO is progressing, promoting that how the nurses and midwives, I think the WHO DG Tedros made a statement that if no health workers, no nurses are there, you cannot achieve the universal health coverage. So that is the message which is globally, which has been given by the World Health Assembly. And again, the World Health Assembly is focused in the 2020 as the International Year of the Nurse and Midwives. Dr. Large Nigel Crisp is one of the ex-health secretary of the NHS of the government of UK, where you know that one of the best health services provided in the world, the UK. The ex-health secretary Lord Nigel Crisp, after the retirement, he realized how the nurses and midwives contribute to the impact and outcome of the patients in the hospital and also in the healthcare delivery system. He took the message how the nurse-led initiatives and making an impact in the different parts of the world. And when he took this evidence-based practices to the WHO and also to the International Council for Nurses, that's how the World Health Assembly passed a resolution called Strategic Direction for Nursing and Midwifery, SDG 2125, because the WHO works with the cycle of the 4 years. So this 4-year cycle, this Strategic Direction of Nursing and Midwifery, where it has given a 4 themes. Investment, one of the theme which is covered in that is investment. And the government of India recently in the last budget was able to sanction the 157 colleges to have the more nursing human resource in the healthcare delivery system in India. So in the second theme was creation of the nursing position. That's a challenging, which I think the WHO is telling not only to India, it is telling to the whole world. The creation of the nursing position is very important. Number 3, it has said is leadership. I think it has evidence as given by the Lord Nigel Crisp how the nurses and midwives in the healthcare delivery system, if they are trained in the leadership skills, they can make an impact and outcome in the patients and also in the healthcare delivery system. So this leadership was Indian Nursing Council was able to bring this concept of the globally in 60 countries International Council for Nurses running the leadership for change program we brought into India, and we have trained about 40 such leaders we have trained, and they are going to further, because this is not going to be a lecture type of leadership program. It is going to be in the clinical units, how certain interventions are going to make a change in the outcomes of the, for example, in the infection control, how the infection control with the leadership, they can reduce the infection control in the clinical units. So that type of a leadership training program we have brought into India, and we have trained 40 people, and which is further they are going to train the many clinical people. See, when the Parliament asked the question for because since nurses are the largest human resource in the healthcare delivery system, how many nurses are there? When the Parliament asked, we won't say that how many are there. We say about 24 lakh nurses have been registered from 1947 to date. We don't know how many are there. Out of the 24 lakhs, many people have died, many people have gone abroad, many people might be sitting at home. So we don't have a live register. So the Indian Nursing Council is the first regulatory body under the Ministry of Health and Family Welfare. We started the nurse registration tracking system. In that nurse registration tracking system, linking with Aadhaar, we have as on today about 12 lakh nurses latest photograph, latest the email ID, latest mobile number, linked with the Aadhaar. We have collected the data. I think this process is going on within another 6 to 8 months. This is going to be freed. Once we have this type of the live register, reliable data which we have, it will facilitate for effective nursing manpower planning at the state level and also at the district level. Many of the district magistrates have used this data during the COVID period. If they press particular district, they are able to get how many nurses and midwives with the different specialities is available in that district. So that has helped them for the planning at the district level. Again, we have the nurse practitioner. I think Dr. Sarin was making a request to start the nurse practitioner program. We have made already nurse practitioner critical care program has been started in 63 institutions in India. And with regard to the nurse practitioner liver, he was suggesting to establish that. We took this initiative, whatever the inputs we got from this institution, our expert team, when they went through, why can't we have a larger organ transplant? The nurse practitioner in organ transplant, so that also covers the liver. So this syllabus has been developed. I think I would like this institution should start, because you have a good infrastructure to start this program, and because many of the state level these nurse practitioners are not there. So in the latest COVID time, many of the ICUs are best managed by these recently trained nurse practitioners in critical care. The Mahatma Gandhi Medical College, Mumbai, Krishna Institute of Karad, many of the intensivists have telephoned me. These nurse practitioner critical care people could manage effectively in the ICUs during the COVID period. So now we have gone further, that in the developed countries, in the clinical level, we have a specialization called Doctor of Nursing Practice. The staff nurses, nursing superintendents, and in the upper level, they will go up to the DNP program. In the education, they will go up to the PhD level. We have brought that program with the collaboration of the University of Houston. We have brought that program to India. Last month, we have started on a pilot basis in Mahatma Gandhi Medical College in Mumbai, a Doctor of Nursing Practice, because the nurses and midwives are going to play a very important role in the healthcare delivery system. Therefore, specialization, because now any ordinary patient would like to is going to tell, I would like to go to the particular specialization. That is the health awareness has come in the public. At the same time, there is a need to prepare the specialized, the trained people to address the issues, especially in the human resource. So therefore, the Indian Nursing Council is taking all steps of preparing, and also we have gone with the quantification of expansion of the nursing educational institution. Quality is a concern. So therefore, we have started a state-of-the-art National Referral Simulation Center in the SGT University with the collaboration of the Lateral and also the JAPAGO and the Indian Nursing Council. We have established the state-of-the-art simulation center. I think there is evidence which is available globally. 50% of the BSc nursing curriculum can be implemented through the simulation. So that that evidence-based study we have brought into India, and we are doing that study here. And also now we have trained about 1,500 faculty in the simulation, because the nurses are the custodian of the patient safety. This concept of simulation came from the pilot training. The pilot is having custodian of the passengers, whereas we in the hospital, doctors and nurses are the custodian of the patient. So therefore, our preparation has to be 100%. We cannot have a 70%, 80%. Any procedures and protocols has to be 100%. So therefore, we have brought this concept of the National Referral Simulation Center to develop the competency-based training program. And I am also very happy to inform you, our level of the syllabus which has been prepared by the Indian Nursing Council, the developed country like Brunswick, Canada, Brunswick University is coming to, along with the regulator, coming to Indian Nursing Council by seeing our syllabus with the 50 hours of the online training, they are willing to give the dual degree. So now the 30 supernumerary students in Manipal are getting the same, without going to Canada, they are getting the dual degree program. So our aim is to prepare the quality of the nursing education people, especially now the nurses are in more demand in the different parts of the world. Even we have allowed them to have the foreign language in the existing institutions, so that the French and Japanese language we have introduced in some of the nursing colleges, so that we are able to train the best of the nurses to the world, not only to the India and also to the other. So it is one of the best career which the nurses are able to get it. So with this, I am very happy. I want to thank the organizers for giving me the opportunity to be with here, because many of the nursing students who are here, I think you have a good future in the healthcare delivery system. Your participation, and the government of India is making the community health officer at the sub-center level, that itself has given a lot of opportunity to work in the preventive and promotive area. Wish you best of luck. Thank you very much.